Hi, I'm going to talk about reading your own psych records. So whenever you go to an auto body shop, you don't go there and you say, hey, look at how awesome my car is. I love the paint job. It's super fast. It's an awesome car. You say, I brought it in because there's something wrong with my transmission. You're not going to spend the time at the auto body shop talking about all the positives about your car. You're going to say, here's the problem. Let's fix it. So when you're reading your psychiatric record, you're not going to be reading about that time where you helped your neighbor move furniture or how kind you were to that old lady at the grocery store. You're going to be reading about all your problems because the sessions that I'm recording aren't focused on what's not a problem. So the majority of what you're going to be reading is going to be negative stuff. And people are already in their heads enough. If they spend time reading all these negative things about themselves, they're going to ruminate. And it is really not great from a psychological perspective to sit and read negative things about oneself. And legally, psychotherapy notes do not have to be given to the patient. So if you go to your endocrinologist and you're getting blood work done and you ask them for labs, they have to give you that, but a psychotherapist doesn't have to provide the psychotherapy notes to somebody. I mean, think about it. It could actually cause psychological harm to people to read that kind of stuff. So there's risks, no changes, no obligation, and medical terminology. So no obligation, we're under no legal obligation to provide patients with their notes. And so psychotherapy notes are notes recorded by a healthcare provider who's a mental health professional, documenting and analyzing the contents of a conversation. And that's just the legal terminology. So we're under no obligation to provide anybody with those notes. The other thing is the risks. So like I said, reading all that stuff about you, do you want to do that? I mean, it doesn't make sense to go into psychiatrist's office and just say all these good things, right? Because they're not the things that need work. So you're not going to be reading a whole bunch of nice stuff about yourself. Of course, there's going to be positives here and there, but that's not the main point of what's going on. And then the other thing is I'm not going to make any changes. Sometimes people request their records so they can look through it and change it how they like. So if it says a family history of alcohol and alcoholism, they're going to say, oh, I don't like that. Can you take that out? No, I'm not going to take that out because it's really important. Alcoholism runs in the family. I need that information. I need it in the record. I'm sorry, but I'm not just going to go through and alter your record just because it sounds kind of negative. So no changes are going to be made. And medical terminology. So one of the classic examples whenever people started reading their own records is SOB. And so to people who are not physicians, SOB is a derogatory, mean term. And so people were getting offended, but when you're a doctor and you write SOB, you mean shortness of breath. And so little things like that's just an example, but there's a lot of medical terminology in medical notes that unless you went to medical school aren't going to make sense and can actually come off as offensive, like in the case of the SOB. So you're going to read things and it's not going to make sense. So I really don't think, reading your own psychiatric notes is probably going to be a good thing, but everybody's, entitled to their medical records. But an analysis of the psyche during a very negative time can actually be detrimental to any kind of treatment progress.